Okay, welcome everyone to the From Vaccine to Vaccination webinar series taking place all this week. My name is Rola Kaakeh and I'm the CEO of Salus Vitae Group, and I'll be the host for the event. At this point in time, we're all waiting on the COVID-19 vaccine. The speed at which the vaccine clinical trials have been conducted, reviewed, and approved is unmatched in history. It's truly unlike anything we've seen before. But on the brink of this new vaccine, an enormous challenge awaits us: the distribution and administration of the future COVID-19 vaccine. We are now not only focusing on the vaccine, but on the vaccination process. Hence, we're discussing from vaccine to vaccination. As part of this week-long series, we're very lucky to have 6 leaders from across various settings share their experiences, explore recommendations, and propose actionable strategies as we prepare for the deployment of the COVID-19 vaccine. These leaders come to us with diverse backgrounds and expertise. We had a health economist yesterday. We have vaccination experts. We have executives of global organizations representing millions of pharmacists. We have a dean of School of Public Health, as well as the dean of a School of Pharmacy. We also have an informatics administrator, as well as an on-the-ground clinician implementing the strategies discussed. Now, over the course of an hour in today's session, we ask our guest speaker a number of questions. I will start with the questions, and then we'll open it up to audience questions. So if you have any questions at any point, please submit them in the Q&A box below. You should see a little icon in order to do that. And then we'll get to those towards the end of the hour. We encourage you both during and after the event to post your takeaways from the event in the Q&A box and on various social media platforms, and tag us at Salus Vitae Group. We love hearing how you benefited from the various insights and experiences of our distinguished speakers, and we hope to pass along those insights to others. Now, this session will be recorded and available for replay after the event. So let's go ahead and get started. I'm very pleased to introduce and welcome our guest speaker today, Dr. Catherine Duggan. Dr. Duggan is the Chief Executive Officer of the International Pharmaceutical Federation. She took up the role in The Hague in June 2018. Catherine is responsible for visionary leadership, support, development, advocacy, and growth across the 150 member organizations and the 4 million members that FIP represents. She's also responsible for developing and the delivery of the strategy, planning, and working across global organizations such as the World Health Organization and the United Nations and other international professional groups. In 2019, Catherine chaired the World Professions Health Alliance, which represents 31 million health professionals across medicine, nursing, dentistry, and pharmacy. She also signed the FIP MOU with the WHO in May 2019 at the World Health Assembly meeting, which consolidates the collaboration and secures how pharmacy contributes to primary healthcare to deliver universal health coverage. Now, upon taking the CEO role, Catherine was awarded the honorary professorship from the School of Pharmacy, University of Nottingham. She has also been awarded fellowships of both the RPS and the UCL School of Pharmacy, and is a fellow of the Royal Society of Arts. In November 2020, Catherine was awarded the APSTJ Nagai International Women Scientist Award in 2021 on behalf of the Academy of Pharmaceutical Science and Technology in Japan. Dr. Duggan has published widely and presented at national and international meetings and has a wealth of people and program management experience. She's a recognized leader across the profession, working with many networks within and across the profession, and more widely, health and business. Catherine has worked in community, primary care, hospital, and academia. Thank you so much for being with us today and for taking the time to discuss these important matters with us.
It's an absolute pleasure, Rola. I'm so delighted to be part of these events and hope I can fulfill your expectations. When you read someone's CV, it can sometimes feel a bit daunting to hear about yourself as well. So I'm really excited.
I'm sure we're really looking forward to having such a rich conversation. Now, the conversation is actually going to follow several themes. Today, We'll be discussing some lessons learned and current strategies. We'll be talking about the workforce requirements and how to prepare. We're also going to be touching on the topic of equitable access, as well as the huge challenge of misinformation and what we need as we communicate moving forward. And then we'll also talk about the role of various stakeholders. And I know that you've worked with so many across your career, and so providing us some advice there. And then of course, we're going to conclude with just general advice that you would give moving forward. So let's just go ahead and jump right into the questions. So the first question is, what have we learned thus far from the current and previous pandemics that will prepare us for the COVID-19 vaccine?
I think, Rola, we have to think that this year we're learning as we go. And for some of the health professionals involved, this is a bit of a change in mindset. There's no rule book for how we can manage this. And that's quite freeing when we think about it. But what can we learn from previous pandemics? You can see that many of the countries that were able to respond very speedily and to take the COVID-19 outbreaks in their nations very seriously and act very promptly were the ones that had had some previous experience with SARS viruses previously. And countries like ourselves in the UK, we had an awful lot of pandemic preparedness focused on flu. And I think that makes you realise that we were perhaps not quite as prepared as we could have been. So I think there's something about having experienced it in recent history has really helped other nations respond very, very speedily. Other things that we should note, that there are various waves to pandemics, and the virus is still there, even if you've locked down and you've put in place all the social restrictions you possibly can. The moment you start loosening those restrictions, people will get infected. And then, of course, we have the worry about infection and progression to hospitalization, and then progression into intensive care. And, the preparedness of our hospital services in this instance. We've then got a lot of understanding now from the first wave that happened earlier in the year around how we might prepare as we come out of the autumn into the winter for right here, right now. And that includes how do we prepare our very elderly patients, are very comorbid patients or at-risk patients, learning from what has gone on previously. And perhaps those learnings wouldn't have necessarily come from another pandemic. If you were going to write the rule book again, if you could go back to January 2020, knowing what we know now, we would understand that this has exponential growth, so it's not linear, and it can get out of control very quickly. We would also learn that different ethnicities and different levels of comorbidities within societies alongside age increase the impact of the disease. And I think this will be very important for understanding how we manage the vaccines and how we ensure equitable and equal access, which I know we're touching on later.
Great. I like how you mentioned our lessons learned from previous vaccines, but also within this current one. We've been in this pandemic for 9 months now, and there's a lot that we've learned. And I know we keep talking, it depends on where you are in terms of second wave, first wave, if we're even still in the first wave, but understanding what, how much of what we've done will actually help in the immediate or the long term. So I think thinking those types of approaches, like you said, the masks, social distancing, those certain things might be here to stay for a certain amount of time. And so we have to kind of understand those as within our lessons. So I really like that approach. The next question gets at more of the global pharmaceutical supply chain. We know that our pharmaceutical supply chain relies heavily on other countries, wherever you are, I think, in the world. So do you think that the global pharmaceutical supply chain is really ready to meet such a demand? Because if we think about the distribution now of the vaccine, it comes from various different countries. So how do you see that? What are your thoughts on?
So I think if you were going to talk to me in December 2019, when we were doing our business plan at FIP, we already had identified that supply chain shortages and literally safe medicines production were a really big issue for us in 2020. Drug shortages are a huge problem globally, and this was being identified in all of our work in 2019. And then, as with everything else in 2020, with the pandemic on top, it's like a great big light bulb is shining on the areas that we already knew were at risk. The one thing I would say is that in an emergency, all agencies of credible note step up and step into the space that they need to. And I see what we will, I predict what we will see more and more is that the cooperation and collaboration in order to get our world vaccinated will be unprecedented. That doesn't mean that there aren't challenges. There are huge challenges. There are challenges around where particular elements of a vaccine, albeit, the vials all the way through to the core ingredients, all the way through to excipients and then storage, where they are all manufactured, and then how do you get that distribution chain in a smooth and seamless way. I've heard other organisations talking about the 25 feet rule. How do you get the medicines from central distribution units all the way through to, almost the curbside before you get to a clinic? And it's a real logistics effort. What this may well do for us is to demonstrate where we see the pinch points in a system and how we might have some lessons learned, some really core lessons learned that would address shortages once we come out of this pandemic, and supply chain solutions that we will keep going with following the pandemic. But I would say, Rola, that most people have their shoulders to the wheel in terms of making a solution. So some of the things that would have got in the way, like the politics or logistics, or one company having one role and therefore not sharing with another company, I think we're seeing all those barriers coming down for the moment. And what you and I would need, or what we would compel those organisations to do, is to make sure the barriers don't come up too quickly after the pandemic, and we really take what we need to our next stage.
I love that you use the example of drug shortages, because this is something that we've been working in this space as well. And to see the level of urgency, like I think COVID and the pandemic has increased that level of urgency kind of across the board to look at supply chains, but is now shined more light on the pharmaceutical supply chain, which we hope then, exactly to your point of understanding after, not necessarily kind of after COVID or after looking at the vaccine, will that have ripple effects on the other medications that could potentially reduce drug shortages? Could we improve that? So there are definite lessons learned to use, but we would actually have to also take those and move those, right?
It's just to add as well that we shouldn't forget that the supply chain issues for all medicines that patients are already taking came into sharp focus and sharp contrast. And the one thing that I would say, with the International Pharmaceutical Federation, that pharmacists everywhere were involved in ensuring patients could get supplies of their regular medicines, as well as some of the medicines they may need during COVID. And actually, some of those solutions we need to keep in our back pockets for when we come through the pandemic, because it shows you a crisis can really help you see a way through that perhaps 2019 didn't allow us that clarity. So apologies for adding to that, but I think there's some positives to take from such a traumatic year.
Yeah, no, I agree. So the next question ties into strategies that are deployed on, this question has like multiple levels, on a global level, which you see often, and then talking more about various national and state maybe or local level types of initiatives that you've seen as they begin to prepare for the vaccination process. And how do those vary in your opinion? Yeah,
that's the issue, isn't it? So we're just in the middle of running a program of events that's looking at these kinds of issues, Rola, so it's really timely. And what we're doing right now is looking at the WHO regions and how countries that are enabling all their professions and all health workers to be part of the vaccination solution, how the lessons from them can be not even just showcased to countries that perhaps haven't got those solutions in place, but fast-tracked. There's no time really for those countries to do all the steps that country A may have done to get to the successful workforce enablement that is in place in country A. We need to really mobilize and support those countries to fast track these. And we're supporting our member organizations in those nations. And you'd be surprised, in each region, We've just done our 4th regional meeting today, and we have 2 more this week. In each region, we have countries that are enabled and empowered and countries that aren't. It's not differences by region, it's differences within regions. And we're supporting our member organisations with letters to their ministries of health that explain how it's been done somewhere else. That's often very helpful. And just the logistical steps of how we can unlock some of the potential of the workforce to step up and do this. And what we can see is that maybe this could be replicable, but when you see a neighbour doing it in a certain way, and you are a country or a state that hasn't got those enablers in place, you can peep over and see what your neighbour's doing well. That's really adapt and adopt, which is a mantra that we have in FIP. We don't enforce and impose, but we give people toolkits that they can adapt and adopt. And, you know, for a pharmacy workforce to be part of this solution, again, I know we're talking about workforce later, we are a very highly skilled workforce and we're very good at logistics and safe practices. So for us to move into the vaccination space is not a great big, you know, unheard of leap. It's literally a training program, and there are many in place, and it's really almost like an easy solution. We're gathering some figures, but we've almost seen an exponential growth of countries that have enabled their pharmacy workforce since the beginning of the year to do it. And together with other regulatory changes and freedoms that we've seen put in place over 2020 to enable pharmacists and pharmacies to supply drugs better, to maybe take on more prescribing and transcribing, those regulatory relaxations haven't caused any danger to patients. They've just ensured access. So we're also doing some lessons with our regulators about what regulatory freedoms would be good to keep post-pandemic to ensure that you end up with this seamless supply. So I would really say it's about the learning from each other, but not learning to do it from A to B to C to D, almost like a route map. You have to just pick it up, adopt it, and implement it. And our countries are being great at partnering up to support change and transformation in their neighbouring areas. I'm sure it's the same in the States, and I've seen an awful lot of legislation that has been almost freed for pharmacists and pharmacies to be able to step up and step into this space and really provide a public health solution, as they should, but everybody has put their shoulder to the wheel.
So the adopt, adapt, I absolutely love in terms of giving them the tools, the benchmarks by which they can learn from each other, but then as well as they're learning, to your point, to see who is similar to you, what are they doing, what can you learn very quickly. I also love that you mentioned that although we're so focused on changing policies and regulations to adapt to the current needs right now with COVID, having the thought process of what's after this, how could this benefit the pharmaceutical supply chain in general, or benefit and improve access in general? Can we implement this to other programs that would greatly benefit? Kind of those tag-ons, I think, is a great way of also looking post-pandemic, or looking at tying in what you're currently doing to improve those as well. So I love those strategies of keeping that in mind, that it is not the only disease state or the only issue that we have right now. And so I like that. So can you speak about the administration process? Who you think will get the vaccine first? Who do you think is likely just to administer? Is it mostly going to be pharmacists right now? You know, what are your thoughts on that whole, what that process will look like in terms of administration?
So, Rola, you'll know that today in the UK, I'm based in the UK at the moment because I can't travel to and fro to The Hague in the Netherlands, which is where the FIP headquarters is. In the UK, we've had our first day of vaccinations. They're calling it V-Day here in the UK. So the first patient to get a vaccination is a 90-year-old lady this morning, and that's post-testing and the first person to get the licensed vaccine. Different countries have different approaches, but most of them have taken up the idea of having a task force that looks at prioritising for their needs, their patient need. For a country like the UK, age is the biggest risk factor in COVID, and in an ageing society, it has to be age-related. So there is an issue around balancing, getting as many people over and above a certain age group vaccinated in this first round, as well as getting health workers and care workers vaccinated as well. And of course, what we've got is a little bit of a double cycle. For the first 3 weeks, you would be vaccinating new recruits all the time. Then after 3 weeks for the Pfizer vaccine, we know that you have to have your second dose. So then, of course, you have to almost have double capacity of your vaccinators in place so that you can vaccinate those who have come through the third week, but you're also continuing the steady state of vaccinating new people in the population. And that doubled up will take place then again and again and again. So the logistics around this are really tricky. But in addition, we've got all the storage requirements of this vaccine. So what we also need is to think about when the other vaccines can come on trail and be available, so that what you're doing is you're opening up access more widely at that point. And I think it's also worth noting, as I understand it, that you aren't protected until 7 days after your second dose. And that kind of communication to the public needs to be really, really clear. So it's about being patient and about being tolerant of who is first in line, who is second in line. And I know that different countries have got different priorities because their demographic, their people demographic changes and is different per country. And I don't know how much time it's taking logistically, but I do know that day one will teach us a lot from the UK, which other countries would learn from. And
you bring up now a point that will go into our next question about the 2 doses. Of course, that is logistically more complicated than a 1-dose vaccine, but also the tracking and the documentation of that. Have you heard of anything of different strategies institutions or countries have used to try to track, you know, what vaccine? It's not even just that you got the vaccine, but maybe did you get the Pfizer one or the Moderna one, or, you know, what types of tracking systems have you heard of for these?
Well, countries that don't have good tracking systems in place are going to have to put them in place pretty quickly, because not just even for an equity and a safety perspective, understanding that you or I may have had 1 dose or our double dose, and which ones have we had, and then follow up. But also just because the numbers of doses are limited at this point in time. So you have to, if you are the controller of administration, you do have to keep your eyes on the supply that you have versus the demand that you have versus the access that you have. Those 3 things are really big conundrums to manage. Of course, in many health systems, we have health numbers. So if you are registered in the UK, then you have an NHS number, and they will track, you know, when you've had your first vaccine, when you've had your second dose, and which vaccine you've had, and then you're followed up automatically. And they have very good systems in place, from childhood vaccinations all the way through to, of course, adult influenza vaccinations, where they can track you. And this is just being built on for this right now. I would imagine within the next month or 2, we'll look back and see how could everybody do this really slickly and really seamlessly, and make sure that you've almost got a big vaccine database per country. I think it's going to be really interesting to see how willing patients are to have that information, even if it is anonymized, shared. And you know, it's an interesting big global experiment we're all in at the moment, and it's yeah, we're going to see an awful lot of sociological behaviours and influences coming out of all of this, I think.
Yeah, I think in the case of the UK, having that number will make it a lot easier than compared to the United States here, where everything is very fragmented. And you even have to think about it within Chicago, there's so many different health systems. So can you get it at one and then get the second dose at another? And like, do you have to come back? And so logistically, that will be very interesting to see. But the point that you also made in terms of the data being available, would they be willing to have it so that every health system within this area can have access to that information to benefit? And I think that will be very interesting to see how that plays out. Because will you ultimately need to create something like that where it's more open access in order to ensure that? So Wonderful points there.
And it might be, Rola, that you're going to need to think about districts and states and a threshold proportion of the population in that state that would ensure a kind of immunity within that state for it to be deemed safe. And how are we going to measure this? And it's not about, I'm not talking about policing, but I'm talking about the interesting data that we're going to need. The virus isn't going to go away. So we all need to understand that what we do now and then what we might do next year will influence what we're going to be able to do the years after. So being part of that solution and having some open and honest conversations about what are the thresholds for immunity, and could we all really empower people that if they feel they would like to have the vaccine, that they can, and this is why, because we're protecting ourselves, each other, and our communities and our way of life.
So the next question pertains to the safety and adverse events of the vaccine. So obviously the clinical trials and this whole process has been accelerated. It still went through all traditional means of high quality review, but there is the whole reporting system and tracking of the safety and any potential adverse events of the vaccine as millions get vaccinated. Do you also see the experience of people building both the reporting system and tracking system in parallel to this reporting of any adverse events, or have they traditionally kind of been separate entities? I
think you've raised a really good point here. I think we've always thought of the safety of medicines and their use as being someone else's job. I mean, most health professionals will be aware of reporting systems within their countries, but it isn't necessarily something that we're facing with the emergence of a new drug that everybody has to take. So if you work in hospital and you work in a particular specialty, you'll be very aware and immersed in the new medicines and the new drugs that are coming out for that condition, and how you would be rolling that out in particular small numbers of patients, and it would be tested and it would then be monitored, and then you can see further rollout and further rollout. What we're doing right now, and the safety checks have not been compromised, but it has been done speedily. We're going to have almost like the test bed being our patient populations, and recording that and monitoring it appropriately will help us with next year and the year after and the year after. And what we're going to have to do is to make sure that the health professionals feel supported with that and not blamed, that they are part of the solution for next year and subsequent years, not part of the holding progress back or keeping people more trapped. And it's really going to be a bit of a concerted effort. I don't know quite what you have in the States, but from my own health system, understanding how it works in the UK, we'd have what's called a yellow card report. And all health professionals who aren't going to be involved in this vaccination are going to have to be aware of that and to spot things that look untoward, not just in the first 20 minutes or half an hour of administration, but get the patients to start owning their feelings subsequently, days and weeks afterwards.
Yeah, wonderful. So this is a question, and I know it ties in depending on where you are in the world in terms of what country, but kind of globally, do you believe that the COVID vaccine will be mandatory or voluntary for everyone?
Oh, it definitely will be voluntary. In some countries, you may see it being mandatory. But I think the moment you start telling people it's mandatory, you're going to get an awful lot of rebellion. And I think we're probably going to see 3/3 in our societies. We're going to see the people who are very keen to be vaccinated. And despite the fact that they might worry about, the speed with which all of this has happened, they will be vaccinated. And then you have the people who say they definitely won't be vaccinated. And then you'll have people who will watch and wait, and they will see how the first third have dealt with the vaccine, and they'll also start to see how perhaps that may give you the freedoms that they would crave. And that's the thing, you see, if you start making it mandatory, then you haven't given people the choice to get involved. Do I think everybody should be vaccinated? I absolutely do. But do I think you can make everybody vaccinated? I absolutely don't. And I think that we're doing a lot of thinking at FIP about how pharmacists can help with vaccine hesitancy, and how we can help with understanding why people don't want to be vaccinated, and understanding that this may not be a mantra or a dogma, but it may be linked to other belief systems and other cultural issues that the individual may have. I think we've got to do more about talking about the benefits of vaccination. Clean water and vaccination has kept the world going, and you can see what no vaccine has done to the whole world in 2020.
Yeah. And I like that you made the distinction that you are focusing more on the psychology behind it, the communication strategies, getting the buy-in, which we know in healthcare, if you propose any sort of recommendation, you have to get the buy-in in order for them to even implement it or for it to work. And so shifting that mindset that sometimes even a word, voluntary versus mandatory, can have drastic effects on vaccinations.
We've got to depoliticize this. We've got to. We're in 2020, if you think about the last 5 years or so, in many of our cultures, we've got real binary arguments going on. You're either in this group or in this group. And by doing that, you're either pro-masks or anti-masks, or you're one or the other. By pushing people into one of those two groups, you're not affording them the opportunity to change their views in any way, shape or form. The tribalistic political approach that we find ourselves in is not helpful for trying to get a whole population to buy into something that will be of benefit for all of us. And this is the really tricky thing, I think, Rola. Look at the countries that have done this well. They've either done this well because they've got state control, which basically says you will all stay at home and we will police you and we will mandate this. Or you've got leaders who've said, we have to do this together. And maybe they're on a small island or they're somewhere which is more controllable of their borders and what have you, but they've kind of got their population to control themselves rather than be controlled. The countries that have done less well are the ones that have encouraged a binary discussion. And if we do that about the vaccine, if we push people into the I'm for a vaccine or I'm against a vaccine, then we're never going to move the people who are against a vaccine into understanding the potential benefits. So we really have to talk about the public good for this and depoliticize it. And that also means scientists, and I count myself as a scientist, really speaking with empathy and not speaking with derision or with, the facts are the facts and that's what it is, because that makes people who don't want to be vaccinated feel that they're being told they're stupid or that they are ill-informed. And that also forces people into that corner. So if you think about 2020, it's the worst time for our countries that have been having those binary discussions to have a pandemic.
Yeah, I love that approach in terms of thinking about how we group people and then bringing it, because if the focus is one large group, one collective good, are we truly doing that in any small behaviors that we might have, even from a clinician perspective of how we talk to patients, all the way to the rules and regulations that we implement. So now the next question pertains to looking at our campaigns and our initiatives. Are there any outcome metrics that you think we can use to kind of determine success of a program? Or how do we begin to think, yes, this was successful, or, are there metrics that you've been using or do you recommend?
So at FIP, we've been engaging like mad since March, and almost drowning our profession with digital events and accessibility to information. And one of the reasons for this is that, a lot of our profession is frontline, whether they're frontline in community pharmacy or hospital or industry or academia or anywhere that they're working. They may miss something that we will have produced. So we run a lot of things, and we would run similar events or refer back to other events. So we view the over information as good, and it seems to have been really helpful. A lot of people are still engaged and attending, and we see a lot of engagement from our membership and more widely externally. I think when I've reflected on what is good is clear messaging, not confused messaging, and empathetic but firm delivery. These seem to be the two things that you could regard as success. So leaders in countries that describe how they understand the impact of what they're asking their public to do but then describe it very clearly and give timelines and then what we might call thresholds for when decisions may be taken for the next stage and the next stage and the next stage. So what people have then is an understanding that the restrictions that are being placed upon them are in place for a set period of time. And then your leader will be using all the evidence to make the next decision. And you will see that evidence and you will know what is informing that decision. And you will know why they are making those decisions and why they are taking those decisions, and you will feel part of it. And I think if it's done with empathy and it's done with a true understanding that what you're asking people to do, more than ever before in our lives, because, you know, when we had the Spanish flu pandemic in 1918, people didn't have the freedoms that we have today, where we can jump on a plane tomorrow and we can take ourselves anywhere. We have all had our freedoms really curtailed. But where you see good leadership with clear messaging, clear timelines, and clear thresholds for decision making, you see the populations really going along with that much better. And I would say, Rola, that when we go into 2021, over the Christmas break, all of the leaders of the world should be thinking about, how am I going to manage 2021 and what lessons can I take into 2021 that would really help me get a successful campaign and initiative. And I think for our organisations, one of the things that I know, I've kept my team super busy. We've delivered everything we said we would in the business plan and all our digital programmes on top. One of the reasons for that is they feel part of something. We are here to support our profession and our members and patients in the public during this time. So everybody is compelled to do that little bit of extra that will ensure that our pharmacists and our scientists and our educators are supported, enabled, empowered, listened to, have the development, have the right information. You know, we're really responding. And I'm super proud of them, but I do know that that has required clarity and a bit of, you know, me telling them this is how it's going to be until this time, and then we'll think about it. So I'm trying to practice what I preach rather than just telling everybody else what to do. But I think, you know, we said right at the very beginning, we're right in the middle of this pandemic still. And now's not the time to talk about it's over. Now's the time to learn from what's gone on, to implement. If we leave this just to keep on going without learning as we go, we have no idea what our mortality rates or morbidity rates would be.
Yeah, I like how knowing where you're going, even in the craziness that is 2020 and the unpredictable, knowing where you're going, you are much more likely to get there, right? And so having those clear thresholds, understanding what it is specifically that you're working on, even if you have to take it sometimes week by week, month by month, year, you know, not to project out, but to have those tangible items, I think is such a valuable recommendation, because it gives you something that you're working towards. And in the end, you feel more accomplished. Right now, as you're talking about your team and what you're able to do, it's very obvious that you're very proud and you're able to accomplish that, but it's given those steps. Like we know where we're going and what we hope to do. I'm sure, like most people in 2020, not everything turns out as expected, but yeah, but definitely having that path is so valuable. And I think that is so great for our audience to hear. I do want
and it's also so important, just to add to that, so important. When we look back and think about some of the missteps, I'm not going to call them mistakes because nobody had the script for this year, but missteps. Some of our politicians or our health or our scientist experts have made these predictions like, you know, if we get away with having this number of mortalities, we will be doing well. And suddenly what you've given the public is this target of what good looks like and what bad looks like. And that's not in your control completely. And when we've exceeded those numbers, then the public have looked back and gone, well, that was rubbish, and you're our chief scientist or you're our chief medical officer. And, you know, so it's another point that we all want to paint the picture of when we're going to get out of this. And really we can't. We've got to just talk about what we know, which is time and numbers. And the time, I can tell you by next week where we are. You can commit to that. I can commit to that. Tick. I can tell you then what the numbers are, and that will inform our next decision. That's much more tangible and honest, and you're authentic because you're actually leading with evidence in a time frame. And that, I think, for all of us as leaders, we really need to own that and feel like slow yourself down, pause, and then you can really, you've got to manage what you can manage, don't you?
Yeah, love it. So I do want to talk about, because you do head an organization representing millions of pharmacists. So the workforce capabilities of pharmacists, I'm biased because I am a pharmacist as well, but at the same time, we know their potential is enormous. We know that when we position them in multiple places that they can do amazing things. But the issue that we have now in healthcare is burnout. And people are just getting overwhelmed and tired. So what are strategies going into this vaccination, this huge endeavor as well, where pharmacists have had to do their current workload and then now have had to add to it with the vaccination process? What strategies or advice would you provide in terms of addressing or looking at burnout?
So we've just had a series of events on resilience and addressing additional workload. And what you see is that everybody can respond to a crisis really well for a short period of time. A short period of time is not necessarily days, it was months in wave one. In the Northern Hemisphere, I'm talking about here. Southern Hemisphere, they had their wave one mixed up with their flu season. And, you know, countries like Australia and Singapore, they've had to really manage it in a different way. But we've learned a lot from them for our second wave in the Northern Hemisphere. But what you've seen is exactly right. You know, health workers who've had no leave and they've done so much overtime, they could probably take from now until the middle of next year off as owed holiday. And now they have to do the vaccinations on top. So what pharmacists have to do a bit better than we normally do is we have to share and delegate. And we also have to prioritize. And we have to explain to our patients how we're going to manage ourselves and how we're going to be changing the way we deliver services. And that sometimes is something that we take for granted in pharmacy, because especially if you're based in the front line in the community, you think you can explain things to your patients as they come in one by one. That's too exhausting when you've got queues and queues of patients and you're supposed to be vaccinating at the same time. I would say that we need to deploy our early career pharmacists to help in roles they may be, you know, that the senior pharmacist might often be doing, and enable the pharmacists who are vaccinators to focus on that. In addition, we may need other parts of our workforce to step in, either to vaccinate or to be part of the running of the pharmacy as well. And that all needs to be communicated to patients and the public. It may well be that we need to start describing how things might look at local town hall events, or it might be that we need somebody in high positions to explain that at one of the State of the Nation addresses, so that you actually have a pharmacist who's in government who describes how things might look in hospital, community, or frontline. But I think the thing that we need is for pharmacists to feel they're part of the solution, that they're part of that frontline workforce, but the delegation and the support from others who can step into roles that they already do day by day will be there. And we've seen some really good successes around early careers or even student pharmacists going in and helping, not acting as pharmacists, but helping with the general workload in a pharmacy during particular times. And this is really, I mean, it's really amazing. Also, recruiting from communities at that time to help in pharmacies is really important. No one size fits all, but it's that concept of there's double the work to do. I need to deploy and delegate, and I need to lead on the things that will have the greatest impact if I'm the most highly skilled person.
Yeah. Prioritize, delegate, communicate, for sure. I really like that. I do want to talk about equitable access. The next question addresses how can we ensure that populations with the highest risk and those disproportionately affected by COVID-19 receive the vaccine?
We mentioned earlier on, didn't we? We talked about how different countries may be having task forces that may identify the different strata in the population relative to that country. And then you start to think about this regionally and then globally, and you start to see that in different regions you may have different priorities. So, you know, COVID really, really impacts the older populations and the frail older people. And of course, they're more at risk of everything as well. So they're just an at-risk group that we need to prioritise in countries that have ageing populations. In other countries, that might be slightly different. It might be that you have patients who are more susceptible to a certain disease like diabetes that you need to prioritize first. But I would say that looking at the demographics of the mortality of this disease and thinking about how those demographics map onto your nation or your state or your region is a very good way to start that prioritization process. And then you start to think about where do you have those people so you can deploy that workforce to help with the vaccinations. I think in some of our countries where we have multiple ethnicities, we actually have a more complex situation to manage. In other countries where they have single or a few ethnicities, ethnicity becomes less of an issue. If they have a definite prevalence of one of the non-communicable diseases, that may well become their prioritization matrix number one.
Yeah, here in Chicago, we have different neighborhoods based off of, and COVID-19 has unfortunately impacted various neighborhoods to very different degrees. Neighborhoods of people of color, lower socioeconomic, have been significantly impacted. And so as they begin to start thinking about deployment of the vaccine and how do we get that based off of the phases that your local or health department has determined. So those will start, will be interesting to see as the days go by. I do want to talk about misinformation, and communication strategies is something that you have consistently mentioned the significance of throughout this talk, which I think is very, very valuable. But right now, in the world of so much information that we also have the issue of misinformation that is available, and that misinformation is taken to create more hesitation or lower confidence in specific initiatives or the vaccine itself. How do we build public trust and address this whole issue of misinformation?
It flows, doesn't it, exactly from what we spoke about earlier. So this tribalistic way in which we have to take sides about whether we're positive towards something or negative towards something, whether that be politics or it be vaccinations, really enables misinformation on both sides. And I think there was a very interesting point in an event that I was chairing a couple of weeks ago where we had the CEO of the International Federation for Aging, where she was describing, and there was also a colleague there from Johns Hopkins University, who was describing the fact that trust comes about from a feeling of being listened to and being heard. And if you have got someone or a population or a community that are very vaccine hesitant, to be able to listen to them and address their fears, not with you're wrong or you're stupid or you're ignorant, but with I really understand that would be fearful for you, but here are the facts. It's really, really important. And it's also understanding the things that have been done in past years that then will have been passed down to families about, experimentation on certain groups within our societies, how people were used and abused through different medical interventions or how they were castigated at different points, really should give us some insight. So for me, it's seeking to understand before we demonize, but also at some point understanding that there may be some people who never change their mind. And how are we going to manage that? And that's what I was meaning about, understanding how we're going to get the data for each of our districts and our areas of living that gives us the idea that we've reached the threshold for immunization in that area. But also not letting people just get away with the fact that I believe vaccines are bad and therefore I'm not. Really challenging in this trusting way. I think I would expect, if I'm taking a step into the vaccine hesitancy world, that someone in the vaccine hesitancy world would take a step into my vaccine acceptance world, and that we could come to some kind of shared agreement around what our next steps are. And I think this is the whole social responsibility and social contracting that we haven't had the opportunity to really debate. I mentioned it to you earlier on about the countries that have either state-controlled by some kind of state authoritative approach, or the ones that have really compelled people to do the right thing for their neighbours in some kind of contract of social responsibility. So for me, really, that the whole thing about public trust is about people feeling heard, understood, listened to, and then empowered to make the right decision. And if they don't want to be vaccinated, then it won't be because we've pushed them into that corner. It will be because they've actively moved into that viewpoint.
It's a point that you made, which I think many people forget about communication strategies, is that listening is a communication strategy. And so I love that you emphasize that, because if you don't listen, if you don't integrate that to build that trust, however you position your statements, however you communicate, it could go on deaf ears, as they say, right? And so I think highlighting that listening is such a critical part of how you're going to communicate for this is wonderful. So we're just going to have one more question before we go into the Q&A, and that is more revolved around general advice that you would provide public health institutions and health systems as they prepare for the vaccine.
So I think a unified approach. You know, it's easy to talk about this from the UK, and we have a lot of critics of the National Health Service, but we also have a lot of plaudits. And, you know, in a way, the NHS is the UK's form of religion. The fact that everybody mobilises around something that is national, even though it is devolved across England, Ireland, Scotland, England, Northern Ireland, Scotland and Wales, really unifies people. So my advice would be to organisations and countries that or states that don't have a unified system to create one for this pandemic. Literally time limited. Once the pandemic is over, we will go our separate ways. But during this time, here are the principles by which we will work. We will all put our shoulders to the wheel. We will all manage our patients. We will all provide the logistical support that's needed at this point in time, because we're all focused on the end result. And what you do by doing that is you get the solidarity that you need during a time of crisis. Rola, you mentioned that everybody's exhausted and burnt out. It's second wave. We're going to have Christmas in the middle of this. And then we're probably going to have, coming out of that, January to March, we're probably going to have a third wave. And that's why we're trying to get people vaccinated. So as you said, you know, managing a third wave with the influenza cycle on top of trying to get everybody vaccinated is a really tough call. So the only way we're going to get through this is through solidarity and teamwork, and everybody realizing we're all on the same team. We're all on the same team here. I think there's something about unity through unifying. The sense that we're all on the same program will give each other strength. That's not a mean feat at all, but it does go some way to, you know, thinking about Chicago. You have the Bulls and the Bears, don't you, in your sports, and thinking about how do you unify them around a shared endeavor right now, some kind of campaign. You'd have to pull people from both sides, wouldn't you, and get them all to really be empowered. That's what you need to do in Chicago. That's what you need to do in the US. That's what we need to do globally.
So we do have a question in the Q&A box that asks, do you think that through vaccination we can control the pandemic? Since we're not all able to have a massive vaccination all over the world at once due to financial, health systems, political burdens in some countries. Since to protect our own community, you shall protect other populations as well. So what are your thoughts on we think that vaccination can control the pandemic?
So the real facts of the matter are, we have a virus that isn't going to go away. And the moment that we as human beings understand that bugs, whether they are microbes or viruses, are smarter than us, the only mission that they have on Earth is to become resistant or to grow and infect, then we'll get our heads around it a bit quicker. I think the idea that we were sold in the beginning of the spring that we would be out of this pandemic by summer has really shaken quite a lot of us, because here we are in winter and we're nowhere near out of it. This is a long-term thing. So vaccination is the only route out of this. We've got some things to consider. We've got to consider, how do we manage ourselves while we regulate and deploy the vaccines that will come online? How do we give our health systems the space that they need to be able to manage, in the Northern Hemisphere, influenza, COVID, all the backlog of other conditions which we haven't even touched on today, which just means that the burnout is even bigger, alongside waves of the virus that are caused and exacerbated by social activity. alongside how are we going to ensure safe and appropriate access. And this will be about creating social contracts in our families and in our communities and with each other, and being very honest. The Spanish flu, I understand, had 3 major waves. And we've got to remember that there weren't as many people in the world at that time. I think there was 2/3 of what we have right now. And that people didn't travel around as much as we do now. And there were all sorts of factors for why that might not be completely comparable. But the idea that we're going to get out of this pretty soon is, it's going to take a while. It's going to take some time. I'd say by next summer, we will see enough people vaccinated to give us some security. And if we don't see enough, we will know how many we need, which is why I was saying about you need to monitor it. In the meantime, we do need to do that whole managing our social distancing and stuff, but we also need to think about how are we going to unlock our economies and keep our mental health buoyant, our young people mobilized, excited, you know, not ground down by this. So there's all sorts of other balances that we're going to need to think about unlocking. One thing I would say is there's no right or wrong way to managing vaccinations. In some schools of thought, they're thinking about vaccinating the people who would be better placed in the workplace first to get people back into the economy, and then thinking about our people who are older and more frail, so that we get the economy going, get the main population out there, and then we manage. And I wouldn't know necessarily, I'm not an ethicist, but I think we're going to have to get some balance of both. We're probably going to have to manage our frail populations and at the same time as people who are working in health, working in essential services, and then working in other businesses that we get our economy going. But vaccination is the only key to the lock.
I've noticed too, I was reading different articles about what that will look like too as we travel through the world, and how certain there's going to be like digital passports in a way that like tell you your vaccination status so that you can enter certain countries, and all of that that's coming as a result of it. And so it is going to truly impact, the vaccination process will impact sometimes even how we travel around the world. Because if you think about, you might be in your own little bubble now or community, but you are, since everyone is impacted by how you move in the world, so that will look quite different as well.
And what you bring back to your family, and you know what you, I think the thing is that we've almost been thinking about ourselves. So for me, I travel a lot, and I'd be thinking about, well, I'm pretty healthy, you know, I'm kind of early middle age, so I'm not going to be a big risk. And then I was thinking about, yeah, but if I bring it back to my family, my elderly parents, my parents aren't that elderly, but my father's a bit frail, then what am I thinking? You know, it's not about me, it's about my family, and then it's about my community. And I would leave you with one thing. My nephew, it's his birthday tomorrow, but a few months ago, he's 16, he's going to be 17 tomorrow. But the first time we could get together after the lockdown, I asked him, you know, about his thoughts on vaccinations. And he said, Auntie Catherine, I didn't have any big views on this, but I think it's my duty, my personal duty, to get vaccinated for everything now. He said, it's not about me being safe. He said, it's about making sure that, you know, my grandparents are safe, my family's safe, my friends are safe. And he said, I really feel that's like my duty as a young man in society. And I was like, behind the scenes going, oh my God, he's amazing. He is amazing, by the way, and happy birthday to him for tomorrow. But, yes, you know, when you think the youth, our young people who are suffering more than if you're middle-aged, that they really are wise, and they are, yeah, they're amazing.
Yeah, that's wonderful. And I think that's a beautiful way to finish the conversation in terms of looking at it at a unified approach, our collective desire to help one another in order to help ourselves, our families, and those around us. I think we are all in this together, which is a wonderful theme that we've heard throughout. And, you know, take the time to listen before we give our opinions and communicate, so that we are better able to communicate effectively and design these successful initiatives. So on behalf of Salus Vitae Group and myself, I would really like to thank you, Catherine, for joining us today and for sharing your experiences and outlooks. This has been amazing. I know I'm going to go back and listen to it again. Our next webinar is actually going to be at 4 p.m. today. So be sure to register for the event at Salus Vitae Group if you haven't already done so. Thank you again for all those who joined us, and we look forward to hearing what you've gained from this as well. So we'll see you at the next event.
Thank you so much. It's been an absolute pleasure. Thanks a million.